This medicine is used to help alleviate ongoing severe pain. Tapentadol is an opioid pain reliever and works on specific centers in the brain to provide pain relief. It may also be used to help relieve nerve pain in people with diabetes. It is important not to use this medication to relieve mild or temporary pain. This medication is not for occasional, as needed, use. The recommended dosage and timing should be discussed with your healthcare provider. Before taking Nucynta Air, make sure to read the medication guide provided by your pharmacist. If you have any questions, consult your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually twice a day, about 12 hours apart. Take this medication on a regular schedule as directed by your doctor, not as needed for sudden, breakthrough, pain. Swallow the tablet whole with enough water to make sure that you completely swallow the tablet. If you have nausea, it may help to take this drug with food. The dosage is based on your medical condition and response to treatment. Do not increase your dose, take the medication more often, or take it for a longer time than prescribed. Properly stop the medication when so directed. Before you start using this medication, ask your doctor or pharmacist if you should stop or change how you use your other opioid medications. Other pain relievers, such as acetaminophen, ibuprofen, may also be prescribed. Ask your doctor or pharmacist about using Tapentadol safely with other drugs. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. To prevent withdrawal, your doctor may lower your dose slowly. When this medication is used for a long time, it may not work as well. Talk with your doctor if this medication stops working well. Though it helps many people, this medication may sometimes cause addiction. This risk may be higher if you have a substance use disorder, such as overuse of or addiction to drugs/alcohol. Take this medication exactly as prescribed to lower the risk of addiction. Tell your doctor if your pain does not get better or if it gets worse. Nausea, vomiting, constipation, dizziness, drowsiness, dry mouth, increased sweating, or tiredness may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. To prevent constipation, eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative. Ask your pharmacist which type of laxative is right for you. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including confusion, interrupted breathing during sleep, sleep apnea, severe stomach/abdominal pain, difficulty urinating, signs of your adrenal glands not working well, such as loss of appetite, unusual tiredness, weight loss. Get medical help right away if you have any serious side effects, including fainting, seizure, slow/shallow breathing, severe drowsiness/difficulty waking up. This medication may increase serotonin and rarely cause a very serious condition called serotonin syndrome/toxicity. The risk increases if you are also taking other drugs that increase serotonin, so tell your doctor or pharmacist of all the drugs you take. Get medical help right away if you develop some of the following symptoms: fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, unusual agitation/restlessness. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. When taking Nucynta Air, there is a risk for abuse and addiction, which can lead to overdose and death. It may also cause severe breathing problems. Your doctor will prescribe the smallest effective dose for the shortest time to lower this risk. It's important to talk to your doctor or pharmacist about having naloxone available to treat opioid overdose, and to teach your family about the signs of an opioid overdose and how to treat it. The risk for severe breathing problems is higher when starting this medication or after a dose increase, and if you take the wrong dose or strength. It's crucial to avoid alcohol and drugs that cause drowsiness or breathing problems while taking Nucynta Air. It's also important not to crush, break, chew, or dissolve this medication, as doing so could cause a serious, possibly fatal overdose. It's essential to keep Nucynta Air in a safe place to prevent theft, misuse, or abuse. Women of childbearing age should talk to their doctor about the risks and benefits before using this medication. If you are pregnant or planning to become pregnant, it should be used only when clearly needed, as it may slightly increase the risk of birth defects. Using it for a long time or in high doses near the expected delivery date may harm the unborn baby and cause severe withdrawal symptoms in newborns. To lessen the risk, take the smallest effective dose for the shortest possible time. Before taking Nucynta ER, it's important to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. It's also crucial to discuss your medical history, including any brain disorders, breathing problems, kidney or liver disease, mental/mood disorders, and any history of substance use disorder. Nucynta ER may cause dizziness or drowsiness, so it's important to avoid alcohol and use caution when driving or operating machinery. It's also important to inform your doctor about all the products you use before having surgery. Older adults may be more sensitive to the side effects of this drug, and it's important to discuss the risks and benefits of using Nucynta ER during pregnancy or while breastfeeding with your doctor. It's important to be aware of potential drug interactions that could impact the effectiveness of Nucynta Air or increase the risk of serious side effects. Always inform your doctor and pharmacist about all the medications and herbal products you are using. Do not make any changes to your medication dosage without consulting your doctor. Some products that may interact with Nucynta Air include certain pain medications, naltrexone, products containing alcohol, and MAO inhibitors. Avoid taking MAO inhibitors during treatment with Nucynta Air, and consult your doctor about the best timing for starting or stopping these medications. Additionally, the risk of serotonin syndrome or toxicity may increase if you are taking other drugs that increase serotonin, such as certain street drugs, St. John's wort, or certain antidepressants. The risk of serious side effects may also be increased if Nucynta Air is taken with other products that cause drowsiness or breathing problems. Make sure to inform your doctor or pharmacist about all the medications and substances you are taking. Finally, Nucynta Air may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors about your use of this medication. If someone has taken too much Nucynta ER and is experiencing severe symptoms like passing out or difficulty breathing, it's important to give them naloxone if available, then call 911. If the person is awake and not showing symptoms, it's important to call a poison control center immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include slow or shallow breathing, slow heartbeat, seizures, and coma. It's important to seek medical help right away if you suspect an overdose. It's important to remember that Nucynta ER is prescribed specifically for your current condition and should not be shared with others. It is not intended for use in treating a different condition unless directed by your doctor. In that case, a different medication may be needed. Always follow your doctor's instructions regarding the use of Nucynta ER. If you forget to take a dose of Nucynta Air, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Nucynta ER, it's important to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. If you need to dispose of this medication, make sure to do so properly by following the instructions in the medication guide, or consult your pharmacist or local waste disposal company. Remember not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. And always make sure to discard it when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.